This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches.
Welcome to episode 5. My name is Kim, and I've been a registered nurse for the last 10 years.
And my name is Jasmine, and I've been in healthcare administration for the last 12 years.
Today's episode will be about mental health.
Ooh, yes, about stress and how it can take you out, how it can kill you.
And therapy and medications, and also generational denial, right?
Yeah.
So where do you want to start?
Let's start with stress, because I feel like a lot of people don't necessarily identify that they do have stress in their life. They may not look at certain things as being stressful. And so we just wanted to talk about some things that could trigger you to go into chronic illnesses or depressive episodes and how you can kind of like combat that.
And even acute episodes, right? Because we've both been there before.
Yeah. So some of the most common triggers for stress are, and this is according to Psychology Today, the American Psychological Association, are finances is number one, actually.
Ooh, yeah.
Yes. Especially in this economy, in this day and age, everybody's stressing over being able to afford the basic cost of living, right? So like your rent or your mortgage, your food, your clothes, gas.
Yeah.
I know I have said several times over the course of the past few months that we're about to be vegetarians or vegans or something, because every time I go to the grocery store, it's a minimum of $75. And I have such anxiety around being able to feed myself and my family that I feel like it's just where like a year ago I would get the same 4 items. They would come out to like $35. Now they're coming out to $70.
Yeah, I feel like both you and I have a habit of going to the supermarket and just picking up whatever. And then when we get to the register, we'll just pay whatever because it's stuff that we needed, right? But now, every time that I do a pickup, it's $140 plus. And I do a pickup so that I'm not in there just picking up anything, right? So I'm doing a pickup from an app where I go, I drive, they bring it out. It's a minimum of $140, Jasmine.
Yeah.
How do we get food stamps?
Some people sell them. I can't really talk about that on this platform, but yeah.
So that's definitely
I need some stamps every day.
That's definitely a big stressor.
It is, because that's something you have to eat. So you have to figure it out somehow. And if you fall into that range where you can't get assistance, you can't get food stamps, you have to figure it out. And it's no longer about, you're eating out too much. Mm-mm. No, this is going to the grocery store and cooking at home. Like, you have food at home, and the food at home is costing damn near the cost of food outside.
I bought a head of cabbage a few weeks ago, and it stood out to me. It was $3.28 for a head of cabbage. A head of cabbage. Just one head of cabbage.
I don't know how much heads of cabbage cost, so I wouldn't be able to tell you.
One of the places where I go for a pickup, which is a wholesale place, I don't want to say the name of it here, but it's 79 cents.
Oh.
But when I went to this other spot, $3.28 for the same size head of cabbage. Not to mention the carrots that I put in my cabbage, the bell peppers that I put in my cabbage because I like it colorful. Mm-hmm. None of that stuff, just the head of cabbage.
I can't. So as we continue with this and we tell you ways where you can try to improve your stress levels, some of that comes with eating a balanced diet. And quite honestly, if you are stressed over finances, it's kind of hard to be able to do all these things, like alleviate the stress in your life. Another thing that can trigger stress is work. So
let me drink to that.
Yeah. Especially in the 35 to 44-year-old age range.
35 to 44?
Yeah, that's what they say specifically. We have high levels of depression due to financial and work-related stress. We struggle with just being able to keep up with all of the demands of a job, especially if we have like a boss that micromanages you, that makes it even worse. On top of that, if you have any other factors that would put you up for like more discrimination in the workplace, that is also an additional stressor. So if you're Black, if you're a woman, any other person of color, that's an additional stressor on you, especially if you're in a setting where you're the minority, right?
Yeah.
So you're the only Black person in the group. That's even more stressful, even if you don't feel like it's being made an issue.
Right.
It is.
It's still a lot of pressure.
It is. What else?
We both have experience in that situation.
We have.
So, and I'm still living.
Yeah, you still living in the situation. Yeah. So work-related stress, because you spend most of your time at work. Yeah. You don't even spend that much time with your family, because once you get off of work, you only have a few hours with them, and that time
you take work home too.
Right, you take work home,
So
and then if you work from home, you never leave work. You kind of just roll back over and go to the home life.
Where's the work-life balance?
Yeah,
I feel like that's really important.
It is. And so there's tips to kind of help you balance that as well. I did want to do a quick caveat though on the whole work-related stress thing. Just to let you guys know, I know we're not talking about the solutions yet. We're talking about the causes, but just as we're talking about work-related stress, I was put in a situation at my last job where I was professionally and personally burnt out. I had been going to therapy for a while. My therapist, had heard all of my stories about my job and just like the discrimination that I faced there. Over a course of like a year, she had listened to all of the stressors that were triggering a lot of things for me at that job, and it just became too much. And so I actually went to her and I asked her, could she please put me out on medical leave so that I don't completely burn out, so that I can have a chance to just like relax my shoulders, take a deep breath,
get your life,
get my, collect myself, understand what life is without the stress of that job. So while going out on medical leave doesn't necessarily pay you, if you have enough vacation time, you can cover it, based on how long you want to take.
Is it vacation or sick?
Vacations, sick times. In New York, it's sick time. Yeah. But if you're in other states, if you're like in New Jersey, I think all of our time is mixed together. That's
so
my
it's
experience.
Just like a PTO bank.
Yeah.
Okay.
So she did that, and I took the time that I needed. It really, really helped. I was able to collect myself like I needed to. I was able to take a step back. I did more therapy during that time, so I did it more often, like every other day. And
you guys were doing it every other day?
Yeah.
I don't remember that.
I was doing more therapy at that time. I was actually able to just remove myself from the situation that was triggering a huge amount of stress for me. And it actually helped me realize that, yes, the other personal things I was going through were impacting me, but this was actually a bigger piece than I thought it was, because once it was removed, it was like a weight had been lifted off of my shoulders. And so I need everybody to know that's an option for you. If you are having work-related stress, obviously try to work within whatever confines you have of your job, because we need a job, right? We just talked about finances being the number one stressor. So we all need to have a job, but not if it's going to kill you. Not if it's going to kill you. That's really what it came down to. And so I took that leave, and it was one of the best things I could have ever done. I was able to get myself together, and I actually ended up finding a new job at that time.
Mm-hmm. Sure did.
And that it was one of the pivotal moments in helping to turn things around for me. It really was.
It was the beginning of a whole lot of news.
It was
for you.
It was
a whole lot of like new beginnings for you.
Yeah, and it would never really have happened unless I took a step back and said, this job is stressing me out. Like, it's more than just like, I feel like this is a lot of work. It was I was feeling disrespected and undervalued, and just also doing a lot of work too. And it was just, it's too much. I don't
always took your work home.
Yeah, always took it home. And that was one of the best things I could have done for myself. I highly recommend it. 10 out of 10. Another big factor that stresses folks out are relationships. So whether that is a romantic relationship or some type of familial relationship, mostly what I found was that they were referring to romantic relationships. So right. Who you marry, who you are coupled up with, or let's just say relationships with like your mother,
how
your kids,
about friendships
and your friendships too.
Yeah, those are relationships.
Yeah,
you know how stressful those can be.
Yep. I cannot stress enough. I know recently, the lady Risa Tisa has been in the news of TikTok for doing that Who the F Did I Marry series. That's what it's called. It's about 52 parts of it. And she goes into detail about figuring out who she married. But I'm going to tell you right now from personal experience, because I didn't even have to watch Risa Tisa to tell you.
You watched your own
life. Right. I feel like I'm spilling all my tea during this episode. But who you marry, okay, it's very important.
It is.
I'm not saying you can see into the future and you know who you're marrying and you know what you're getting into, but they can either be a source of support and
peace,
alleviate your stress, right? And peace, or they can be the source of your stress. And cause you to go over the edge, right? When we already have enough
pushing us over the edge.
Right. We already have enough factors that are contributing to why we are stressed. We can't even afford anything. But just having someone in your corner that can either make you laugh or is very supportive of you.
Who knows how to love you.
Yeah.
Who doesn't dislike you. Because there's some times when you're married and your spouse just doesn't like you as a person.
Yeah.
That's never going to work.
It's just not.
No.
So who you choose to couple up with and be married to or being in a long-term relationship with, critical, okay, to your mental health and your stress levels. So,
and based on some of these things that you're stating, their overall health as a person, just overall health.
It literally can determine how long you live. Okay. Now we already know statistically single women without kids tend to be happier. They tend to live longer as well. Okay. Ask yourself why.
Yeah, no, that I can see why.
Yeah.
I feel like as married parents, because there's some single dads out there too, you just bear so much on your shoulders. Like, it's just stressful. Everyday life is stressful. Even if you have routines, it's a lot.
It is.
You're responsible for these other little lives. 9 times out of 10, you're responsible for your spouse's life.
Yes. Yeah.
You know?
It's like a extra child.
Yeah, it's a lot.
Yeah.
So I can see how stress could kill.
Absolutely.
So you got finances, relationships, and what's the third one?
Work.
Work.
Related stress. Those are the big ones that I found.
Okay, I could see how all of those.
And I feel like there's little like offsprings of each of those that kind of also just like contribute to everything. That just puts your body into a state of fight or flight, right? So it activates that in your nervous system, makes you feel like you have to do something to get out of this stressful situation. So I was just telling Kim when I get an alert on my phone, like, oh, your bill, some Xfinity bill or whatever, that for me, matter of fact, I'm going to turn those alerts off because that for me is a trigger now that I'm having this conversation. I don't need to see that because that stresses me out.
I just showed you my FiOS bill
Yeah,
that
no.
just popped up on my phone.
No.
Almost $300. It's very stressful.
Yeah, don't.
And it comes around so soon.
It does. I just paid that.
It comes around so soon. I feel like that's a problem. Like they want you to know ahead of time.
Yeah.
You got 29 days for this is due again.
And all the bills are going up too.
Oh, yeah.
So, I don't want to start.
Light, gas, mortgage. Can we discuss? My mortgage recently went up by $300 because of my taxes that increased and my homeowner's insurance. $300. Let's just
an extra $300 a month. You got it. No, I don't got it because you know what? The work, the work related stress is stressing me out because guess what else? They're not giving raises in the increments that you are inflating all of these other prices. So while you are, this episode is making me stressed out.
Tell them why you mad, Jasmine. Tell them why you mad.
While you are increasing, my car insurance went up, not because of anything I did. I actually don't know why it went up. Maybe I need to
normally it goes up because there's more accidents in the area.
Right.
That's what they did
before. Yeah. So that has gone up. Everything has gone up. The pay is not giving what it needs to give in relation to all these other bills going up. It's just not. It's not. And that alone is very stressful. So, okay, so you have all these things, right? Then you have events that can occur that can cause you to be stressed as well. So, job loss, divorce, death. What else? Even good things can cause stress, like getting married, buying a house.
Oh, yeah.
Getting a promotion. All of these things.
Getting a divorce could be a good thing, too.
Yeah, right. Right. It is, right? We still waiting for that party for me. But
stop!
Coming soon. I'm done.
Sorry, guys. Wait, can I just say one thing to that? We ain't got nobody come to the party.
We don't.
We got nobody come to the party.
And that's fine.
Me, you, and 2 others.
And that is how I want it.
So if you want a party, sis, we can all come together and throw you a party.
Can. Preferably a destination party because I'm not trying to be here partying. Okay. But all of those things can cause you stress. And you may not realize that you are stressed either because stress is going to manifest in different ways in different people. So for me, like whenever I would get my little work related stress and Kim,
any stress.
Oh, that's true. Any stress. My chest would get really tight.
She go into cardiac arrest.
Right. I'm like, I need a defibrillator.
It always attacks her chest.
Right. I need
chest
charge the paddles to 300.
Clear.
I need a pump because it would get tight. I need an EKG. Right. I need an EKG. I just need to know like what's happening. And my mom, whenever she gets stressed, she's like, I gotta run to the bathroom. She gotta go to the bathroom.
You just all time. For me, it goes straight to my stomach. Bubble guts, nausea galore, right? Nausea galore. So, like, it has a different way of presenting itself. Me, I need a gastroenterologist.
I need a cardiologist.
You need a cardiologist. Some people get back pain. Some people get real bad headaches. Some people eat a lot. Some people don't eat at all. Some people sleep a lot. Some people don't sleep at all. It's just different. So you have to pay attention to your body and know.
You have to pay attention to your body.
Yeah.
And then even deeper than that, having long-term stress can cause you to have chronic conditions.
I'm a strong believer in that, Jasmine.
Yes. So according to the American Medical Association, between 75 to 90% of chronic conditions are caused by stress. So these chronic conditions could be high blood pressure, cancer, diabetes, a whole slew of heart issues. So arrhythmias,
CAD, all that stuff.
Right. Heart failure, all types of stuff.
That's so dangerous.
Weight issues, fertility issues.
I can see that.
Yeah, because it's affecting your metabolic system. And then for those who have gone through traumatic events where they have PTSD, it can cause you to have severe depression, anxiety,
Nightmares.
OCD, nightmares.
Is that why I have OCD? I don't remember anything that was traumatic.
Sometimes your brain pushes it to the back so you don't, so it's not to the front. And
wait,
you said
it's not to the front. You said it's to the back, so it's not to the
right,
front.
It's going to the back of the
That is evidence based.
Right. Yes, that's what they said. Right? I'm not a neurosurgeon or anything, but it went to the back and it's not in the front.
Yeah, I mean, did you learn that in grad school?
I did. Right, that's what they had said. It's not in your frontal lobe. So I can't with this. Did I smoke before this? No, I didn't. I promise you, I did not drink. I did not do nothing.
Child, we got natural high.
Right, before this episode. But seriously,
we don't seem stressed.
We don't. Because what can we do about it? But seriously, it can cause these chronic conditions, and that's where most of them come from, right? So years and years and years of neglecting your mental health can lead to this. And why I say neglecting it is because a lot of people have these symptoms. They get the chest tightness or their bubble guts or whatever, or they have the work situation where it's not ideal, but they just keep going in every day. They don't change anything about it. They don't take the initiative to go to therapy, okay? Mm-hmm. Because that is one of the solutions, right? So we've talked about the problems, what it can cause, what you all could be going through, what we've gone through. What can you do to help lessen the stress in your life? Because everyone has stress and everyone experiences it differently. Mm-hmm. So the goal isn't really to completely eliminate it, because that's unrealistic. Like, you're gonna be stressed about something. Like, something could pop up. You could have a loss in your life.
It's just life.
Like, it's gonna happen. So what can you do to deal with it? Like, what are some of the things that you can do? And therapy, I think, is at the top of that list. And I know there are access issues. I think that's gotten a lot better post-COVID, because pre-COVID, you couldn't even find a therapist. You had to go to somebody's office. Now there's apps that are solely dedicated to finding therapists. Everyone does virtual appointments. They are overwhelmed and overbooked. Like, you can barely get yourself in there. Like, booked and busy. Now it's about if your insurance will cover you having a session, and if it's affordable to you, which always, leads back to finances. Right. Because, we don't even get started with that. But having a therapist, finding the right therapist, and actually going to therapy, being present and honest in your session so you can get the most out of it, especially if you're paying for it. You don't want to get up in there and lie.
What are you lying for?
Right, and tell stories and things. No, tell the truth, right? Get into your sessions, make the most out of it, and heal yourself. Like, therapy works.
This sounds crazy, but therapy is therapeutic.
It is. It is. Quite honestly, when I first started therapy, so I first started in 2020 and I'm still in. And I felt like she didn't tell me nothing that I didn't already know, number one. And she didn't tell me nothing that Kim didn't already tell me. So
I wasn't expecting you to say that.
Why am I paying you? And also I felt like therapy was supposed to be like, oh, they give you like some sage advice where you just go off and now you're healed after 1 or 2 sessions. No, it's a continuous work in progress. Mm-hmm. The thing about talk therapy really is that they ask you questions and then you answer them, and you'd be surprised at how you answer them. And that tells the therapist a lot about you. Mm-hmm. And it also gives you insight into how you really feel, because you may not have thought of yourself in the way that they're asking the question
until you actually hear yourself respond.
Yeah. It doesn't feel good. I'm just be straight up with you. Therapy, especially if you had traumatic things happen in your life and they come up during a session, or if you're currently going through something traumatic, it forces you to take a look at not only the situation, but yourself, and see like what role you play in whatever it is. So if you don't like your job,
Why are you still there?
What is it about you that's allowing you to subject yourself to that treatment and stick around for it, right? And nobody wants to question themselves. They want to be like, oh, I'm great and everything's all good and I'm fine.
The same thing for family issues, the same thing for relationships.
Yeah.
Like, why don't you take yourself out of that equation, right?
Yeah.
And I'm assuming that it makes you say, like, I'm better than this. I deserve more than this.
Yeah.
Like, why am I still here?
Yeah. It also takes you out of the bubble of however you were raised or whoever your friend group is and your typical like sounding board, right? So like you may get very comfortable in feeling like something is normal because you haven't had any outside exposure to what things are supposed to be like. Okay. So if you think about, and I hate to get on them because I actually got my dog from Amish people, but like Amish people that just, they don't really use electronics like that. The whole world could be blowing up outside of their world, and they'll just be like, we're breeding dogs and milking cows.
I didn't know that Peanut was from Amish people. Peanut came from Pennsylvania Dutch country?
Yes. Pennsylvania Dutch country.
Peanut is Amish, y'all.
He's Amish.
Okay,
yes.
sorry, proceed.
Pudge was his original name.
What?
Pudge.
Oh.
Yeah, we don't call him that. So
they wouldn't know what was going on.
They wouldn't know what was going on. And then some of them do that whole Rumspringa thing where they go out and they get to experience the real world, or the regular world or whatever. And I feel like therapy kind of does that for you, right? So you come to this person who is, they don't know you, right?
Very unbiased.
You start telling them about yourself and they're like, ooh, like you get to kind of see like, hey, maybe this situation isn't quite normal. It's eye-opening.
But are they non-judgmental?
They are non-judgmental. I have had three different therapists.
I know my friend.
Right. And none of them have judged me, although I felt judged, even though they just ask questions. Yeah. So like if I'm feeling judged, I need to ask myself why. Do I feel like something I'm doing was wrong? Yeah. And that's where the reflection comes in.
Look how that came full circle.
Right. But therapy is hard as you're going through it, but it's beneficial to your everyday life, right? So it gives you the tools that you need so that when one of these stressors comes up, you can do something like journaling or deep breathing. Or deep breathing to help get yourself through those stressful situations. So it definitely, like, I always knew, like, okay, you should journal, but quite honestly, I didn't really have time for it. I felt stupid doing it. But
Journaling worked for you.
Yeah, it was very helpful in dumping all of the things I had in my brain out onto a piece of paper each night so that I didn't go to bed thinking about it and then subsequently having dreams about it, because that's how my brain works, right? So anything that happened throughout the day, I then have a dream about it. It's nasty work. Like, it just wasn't good. And so journaling really, really helped with that.
When you were exercising, was that for stress also?
Yes. So exercising is another thing you guys could do to help alleviate stress. It is not only for you to like look good or get stronger or whatever it is, but it helps. It releases chemicals while you're doing it. When you get your heart pumping, everything in our body is connected. And so when you get your heart pumping and you are, especially if you're doing this like outside. So like another thing I've been doing lately is taking a lot of walks outside. And what I noticed for me is I'm not stressed. And that's probably why we're not really, I mean, I am here and there when I go to pay the grocery thing, that does stress me out. But I pay it and life goes on, right? I don't feel like this impending doom of like, I'm never going to eat again, or let's just eat ramen and crackers. Like, I don't feel like that. And I attribute part of that to walking, being outside, getting fresh air, walking a lot has helped me tremendously.
That's good. And it's a form of exercise.
It is.
Also, it's easier said than done, but you can try to relax. It's hard to relax when you're stressed, but also try to get enough sleep. I know for me, when I'm stressed and something is bothering me, it's the last thing on my brain cells before I go to sleep. And as soon as I wake up, it's on my mind immediately. Mm-hmm. All the time. So it's hard. Do I sleep well? Yes, I do. But when I wake up, right back into stress mode. Ugh. Right back into stress mode. It's hard. So another thing is that you should try to stay positive. Again, if something is stressing you, like when I was going back and forth for my biopsies, people telling me, even you were telling me, stay positive, mm-hmm. Stop thinking about all this negative stuff. It's hard.
Stop Googling stuff.
Yeah.
Stop looking at these forums because you don't diagnose yourself.
And I read so many forums. Exactly. It's very stressful. So, yeah. Yeah. It's easier said than done.
Try to stay positive, right? So instead of asking yourself what's the worst that can happen, what I've been doing for myself, because I grew up in a very negative environment, and so I've been trying to pull myself out of that. One of the things I've been asking myself is, what's the best that can happen? What is the best that can happen? And focus on that. Don't focus on what the worst
that's good advice
outcome could be about any situation. Like, who's to say that's going to happen? You don't know. I'm not Miss Cleo. Miss Cleo ain't even Miss Cleo. She didn't know nothing. Calling me now. She ain't know nothing. She was a fraud. Maybe.
Oh my God! Stop. Know. Her crystal ball wasn't even crystal.
It wasn't. But the people was calling her. Mm-hmm. But she didn't even know, and neither do you. And so why not anticipate the best case scenario, right? We always think about the worst case scenario. Let's think about what's the best that can happen. The best that can happen is everything works out, because if you're still here, it's for a reason, and also you haven't failed yet. Okay,
that's good advice. You go, girl.
I'm trying. I'm trying to take my own advice too.
Also, have you ever used any of those wellness apps? They have wellness apps,
like for meditation.
Yeah, for meditation.
I tried. Yeah, yoga. I have a very hard time meditating, okay? Because as soon as I close my eyes and I sit and the room could be completely quiet, I'll be like, did I take the ground turkey out of the freezer? I'll be like, ooh, how tall is Jesus?
Does heaven have a ghetto?
Does heaven have a ghetto? I've been thinking about all types of random. I can't focus. I also think I have ADHD, yet to be diagnosed, but that's a different topic for a different episode. But that's what I get when I try to meditate. And so I'm not there yet. But if y'all are there and you can focus, those apps do help. They do the little calming, music, the little water, like rain is supposed to help. You can get a white noise machine, which is supposed to help too.
I've never tried meditation.
Your girl has tried it all. And your girl just can't. The brain can't stop, won't stop. That would also be a thing that would come up during meditation. Yeah, why am I thinking about?
Yeah. I can see.
Right.
You
could you just see it
successfully?
I just can't. I can't. I've tried. It doesn't work. It doesn't work for me.
Also, back to this financial thing. You should try to have a healthy diet. That works out good.
The financial thing?
Yeah, because it's hard to have a healthy diet when you ain't got no coins.
Oh, that's true.
So it's kind of like the bad food is more affordable than the healthy food.
I feel like the bad food is inching closer and closer to being expensive as well.
It is.
Because maybe a year ago, I went to McDonald's to get something. And when he told me the total, I said, well, did I get a filet mignon burger? Because for all that price, I could have went to Red Robin. I could have gone and sat down somewhere.
Well,
y'all are trying.
I'm not going to take you back to last year, but this past Monday, Nebo and Corey went through the Chick-fil-A drive-thru. Mm-hmm. Chick-fil-A's with the upper crust.
Yeah, filet. Okay, not fillet.
And I got me an extra chicken sandwich to take to work the next day for lunch. Mm-hmm. The bill was $58.
Excuse me?
And 22 cents.
Well, Chick-fil-A be trying it. They do. If you get a little deluxe something.
I think it was that extra 4-piece chicken tender bupa on the side.
Yeah, quite possibly. They've been trying it. But
$58?
$58?
For 3 people?
we could have sat down and had somebody throwing shrimp and cucumbers in our mouth at Benihana for that price.
Wait.
And I'm not doing that.
Cucumbers?
Yes, I'm not doing it. I'm not doing that with Chick-fil-A. I'm not doing it. And so when you say we have Chick-fil-A at home, you still got to buy the stuff and then you got to make it. So now you're tired and you got to make it. And it don't taste like Chick-fil-A. It don't.
I got these waffle fries from BJ's, y'all. They are pre-seasoned and it's the Berkeley brand. Slamming.
They are. I've had them before.
Why you didn't tell me about them?
Probably because I haven't eaten
I put them in the
recently.
oven so they're super crunchy. Oh my God, they are so good. Okay, sorry.
Yeah.
So
have a balanced diet, not of waffle fries, but like protein, a vegetable, and a starch. Do yourself right. Make sure you're eating consistently. Make sure you're also hydrating yourself. Right, that's important. Hydration. Yes, my crusty kidney sister.
They call me crusty kidney Kim because I don't drink, so I have lemon and water.
Yeah. So make sure you're hydrating. Make sure you're getting a balanced diet. If and this is going back to episode 1 and 2, quite possibly. Make sure you have a PCP so that if you are deficient in any sort of vitamins like vitamin D, that you know that so that you can supplement
because those
in some way.
Will cause other problems.
The deficiencies will cause you to have anxiety, depression. You'll just feel down. It'll cause a whole host of issues that you don't even want to get into.
Yeah.
So make sure you have a balanced diet. One thing I think, and I've always had these, but I don't know if I've necessarily called them this, which of course it's like a hot word now, but set boundaries. Okay. Set those boundaries and stick to them. Okay. If you, it was never on.
My mic.
I can't. If you,
boundaries,
whichever type of relationship you're in, right? Friendships, what have you, set those boundaries, right? Let's just say, so I can give you a real example here. Let's say it's with work. Okay. So for myself, a boundary that I have is that, because I mostly work from home, once I'm done for the day, I'm done for the day. I'm not answering any emails. I'm not looking at them. I may look at them. Sometimes I look at them.
But you don't respond.
But I'm not responding. I shut everything down and I'm just not going back to it. Oh,
that's a new you from your last job.
It is such a new me. And quite honestly, the environment that I'm in encourages that. The expectation is not that I am, checking emails at midnight or sending them at 7. That's not the expectation. They actually don't like that. That's frowned upon.
I refuse to respond to emails too after hours.
Yeah.
And once I shut down, I'm done.
Yeah. So that's an example of a boundary that you create for yourself if you're feeling stressed out at work. Have a window of time, depending on your hours, and don't deal with work outside of that. Because guess what? Unless you are a neurosurgeon and you have to get to your hospital to do a brain surgery on somebody and they're going to die, that thing can wait till tomorrow. Okay? I know they say don't put off until tomorrow what you can do today. But in terms of something that is stressing you out, you have to have boundaries. You have to care about yourself because no one else is going to care about you.
Nobody.
If you don't care about yourself, no one else is going to do it for you. They're not. They're going to run you ragged until they can't anymore. And guess who is going to have to pay for that? You. Because you're going to have heart disease. Right. You have heart disease. High cholesterol.
The sugars.
Right. You have the sugars. You have the salts. You're going to have probably a substance abuse issue because now you're stressed out and now you want to drink or do some illicit drugs because they got you so stressed out. Right. Now your cells don't turn cancerous because you're stressed out. You're not getting sleep. You don't have time to eat. Oh my gosh.
No work-life balance.
Your
family is suffering.
If you have kids, forget about it. This is multiplied by 1,000.
It is.
Okay. 1,000.
It is. 1,000. I look back and I wonder, how did you and I go back to school, go back to grad school? We went at different times, but our circumstances were the same: married, working full time,
Yeah.
having kids. It was not easy, man.
It wasn't. It was very
It was
difficult.
very torturous for me.
I will say that it was a good like little break from dealing with the home life a little bit.
Well, yours was in person, right?
No, sweetie.
It was remote.
Mm-hmm. It was. It was a lot. It was a lot of juggling. It was stressful.
Yeah.
But we made it because we both, graduated. We both got our masters, so we made it. But it was hard.
Mama, I made it.
Right.
No, it was very hard. Okay, so you discussed therapy, right?
Mm-hmm.
I just want to throw in there that there's different types of therapy. It can be individualized, meaning that it's like one-on-one. It could be family therapy. It could be couple therapy. It could be group therapy. Would you ever do group therapy? You kind of, well, no, that isn't considered therapy.
What?
The post-op thing.
No.
Yeah,
no. And even there, I was like, I don't even go to it anymore. That's number one. And two, I just don't really. I'm the type of person where I only speak when I need to, and so in a group setting, it gets even worse because I'm not about to be telling
everybody
all
your
these
business.
people. Yeah, I'm not doing
Yeah,
that. I barely want to tell the one-on-one person my business. Okay.
yeah.
Because I swear, during my last session last week, my therapist did everything short of getting out a cup of tea to listen to the story that I had to tell her.
But I feel like all your therapists get a bowl of popcorn when you start
Right.
when you start talking.
And after the session, she said, "I think we need to see each other every week." I said, "Oh."
That's what she said.
Yes, she said that. I was like, "Oh, girl."
Let me sip my water to that.
I was like, "That's nothing." I was like, "This is actually light for a Wednesday."
Yeah, you've come such a long way.
Yes, and that wasn't even my drama. That was all the other people's drama that was seeping into my life. But
okay.
yes. But
okay.
She said
Bethany wasn't ready.
She
for
wasn't.
that. Bethany wasn't ready.
She said, oh, I said, "Okay, girl."
She said, "I need to see you and
Right.
these people."
I said, "Buckle up. You just got here." So no to group therapy because I think I need that one-on-one support. And also, I don't actually want to hear about. I mean, maybe it'll help to make me feel like, oh,
like you're not alone.
Right. You're not alone. It's not so bad. So I can see why it's helpful. But I don't think it would be helpful for me right now.
You really don't want to hear how Gregory's brother pushed him off his bike when he was 4.
I don't.
Yeah.
I don't.
I get it.
Mm-hmm.
Okay. So would you say that the goal for therapy, in your opinion, is that people get to the root cause problem of what is causing these emotional issues that can also turn into physical issues? And then just be able to live a regular, not stress-free, but not stress-inducing life.
Right. Not stress-inducing to the point where you're getting sick, right? So I think the goal of therapy is to get to the root cause of your issues, right? So like whether it's something that happened in your childhood or something that happened recently, and then also to give you the tools that you need to manage those stressful things that come up for you.
And a good therapist will give you the tools.
They will give you the tools. And oftentimes you'll find you'll give yourself the tools.
Really?
That's just how good it is because they just ask the questions. And by the end of, at least for me, each session, I'm like, oh, well, I just answered that for myself. All it took was them prompting me and me kind of like talking through it and realizing like, oh, snap, like, I'm the answer all along.
And you knew the answer all along.
Yeah. I am the problem and the solution. Not really the problem. Though.
That's deep.
A little bit of the problem. Maybe a sprinkle.
That's deep.
Yeah.
Okay. So medications. So there are a few different types of medications that some therapists may put you on when you're having mental health issues, right? So one of them are antidepressants. So this is used to treat depression. But they also, did you know that they also use it to treat pain, anxiety, and also insomnia?
Yeah. So just to clarify, not all therapists are psychiatrists.
All
so,
right,
they
so they
can't
can't
prescribe
prescribe.
medications.
Yeah.
But if you go to a psychiatrist or your PCP or somebody else that can prescribe,
Somebody in the streets.
not in the streets, not a street pharmacist.
Maybe they can't prescribe it,
Right.
but they can hook you up.
They could, and don't do that. That goes along with the medical tourism.
Yeah.
It may not be, and you may be getting some meth. So watch out there. But
well, we had to go straight to meth
because that's usually what it is. Okay, rocks.
Okay.
Get a licensed person that can prescribe these medications to you.
Yeah.
There's also medications that fall into these categories, like Wellbutrin, that folks use for smoking cessation,
yeah,
and weight loss.
Okay? Oh, I didn't know Wellbutrin was used for.
It helps with binge eating disorder. Yeah. So they all impact certain parts of your brain. Yeah. Right? And so that's how they work. Don't ask me exactly how. The
smoke cessation I knew about from me tumbling over that at work, but I didn't know about that. Binge eating. Shut up.
The binge eating.
Okay, and then anti-anxiety medications. They reduce anxiety.
They calm you.
Yeah. So like panic attacks, extreme fear and worry. There have been times when I needed some anti-anxiety medications. I diagnosed myself with needing it, and you probably agreed that I needed it. And a lot of the time, it was my own brain causing me to worry about stuff that I had no control over.
So that's another interesting point that you bring up, because that's also something that came up when I was kind of looking into all this stuff. So there's the external factors that we've already talked about, but there's also the internal things that cause us to be stressed, right?
Yeah, we're
and it is worrying. It is worrying about things that we have no control over.
No control.
That we cannot change.
And it is what it is. It's going to be what it's going to be.
It's going to be what it's going to be. And a lot of it can be eliminated if we just change our mindset.
But that goes back to you saying, think about the best possible outcome.
Yeah.
Right? So when I'm waiting for my biopsy results, I'm thinking, oh my God, I'm going to die. I'm not going to have long to live. In that situation, the best possible outcome that I could think of while I'm stressed is, okay, they'll find it early. I'll get chemo. I'll get radiation. I'll live. That still is still stressing me, because that's the best that I could do at that moment.
Yeah.
Girl, own worst enemy.
Yeah. And sometimes you need not even sometimes. I'm going to tell you a huge part of this and a huge part of lessening your stress is having a support system of some sort, right? Having those people in your corner that can be the voice of reason when you are spiraling out of control.
Mentally.
Right. So when you're thinking, my best possible outcome is that I can get a nice lace front for when I get chemo. No, that's not your best possible outcome. Your best possible outcome is that
it'll be negative.
They'll come back. Your biopsy is negative. Okay. And we move on, and you go get, go for your next screening the next time you're due. That is the best possible outcome.
My next screening is this coming week.
Oh, is it?
The 27th.
Oh, I'm sorry.
But I'm actually not nervous about that.
Okay.
Yeah.
All right. Having those people in your corner that could talk you down from that ledge, critical. I cannot stress to you enough.
If you can be talked down.
If you can be talked down, but just even hearing the words, even though they may not permeate for you at that moment, they're helpful. And you'll look back on the situation and be like, dang, that person really was a source of positivity in this moment. Because honestly, having the negative Nancy's and all that during those moments of doubt and fear don't help. They don't help at all.
Remember, my husband reached out to you because I was on the forums. I didn't even tell you. I was freaking out. I was freaking all the way out, planning my funeral. And he reached out to you. He was like, your friend.
Yeah. And I'm like, what?
You had no idea. He crossed the line, though, because I was going to tell you, but let me tell you at my own time.
He ain't crossed the line because I'm also his sister. Okay? And he loves you so much. Don't make me cry.
You better not cry on this here podcast.
I'm not going to cry. I'm not going to cry.
I'm not going to cry.
I'm not going to cry. But it was at that point where I said, look, what is going on with you, girl?
She shook me mentally.
I said, okay, this is what it is. So I need to know the lay of the land when I get in a situation. All right, well, let's look at it. I'm a very rational thinker, especially when it comes to situations outside of my own situations.
Yes.
I'm like, okay, got this, and this. This is how we're going to deal with it. I'm also a prayer, okay? And so what we also going to do is pray on this, okay?
I had you praying. I had Aunt Lisa praying. I had Angel praying.
Yeah, right. We're going to pray on this. We're going to look at it rationally. We're going to look up some statistics because I love a good statistic, okay?
You said you wanted the analytics.
Right. We're just gonna marinate on it. We're gonna let it be whatever it's gonna be. If it is the worst case scenario, we're also gonna deal with that. Okay, rationally. What we gotta do. Who's taking you to your sessions? Okay. We got it lined up. We have this.
Yeah, y'all. She came in.
Okay. We got this.
I literally reached out to everything that needed a beneficiary just to make sure that my husband and Corey were the beneficiaries. I did. You know I did.
I mean, damn. That's a lot.
All right. Yeah, you had to take a sip to that, girl. Okay. Next one, benzodiazepines. That treats short-term anxiety. Yeah, so like if it's like you're going in for a biopsy and you stressed out, short-term anxiety.
Good little benzo.
And then stimulants. So that's what they normally use for the ADHD.
That's the methamphetamine.
Okay. So like
on the street.
So for ADHD and also for narcolepsy.
Oh, so they're not falling asleep everywhere.
Yeah. So I guess it has the same effect where it keeps you up, it keeps you focused, it keeps you.
They be focused, okay? Yeah. You don't even want to eat. That's how focused you
get. Because most of the stimulants are
appetite suppressants.
Yes. Yep, they are. So yeah, you don't want to eat. And then antipsychotic drugs. So those things treat like psychosis. So you got like bipolarism, schizophrenia, things where you're normally not thinking properly, and also severe depression. Have you ever met anyone who was schizophrenic?
Yes.
Yeah. Okay.
Yeah. Oh, because I used to work in a mental health.
Oh, right.
Facility.
Right.
Which I will never do again.
When I did my psych clinical, it seems like every week my patient was schizo. And sorry, no disrespect when I say schizo. It's just short for schizophrenic.
Yeah.
They're very godly. Very, I am God. And
okay. They have a God complex?
Yeah. Yeah, they're very godly. Very, very, very godly. They think highly of themselves. The ones that I've encountered. Okay. Yeah, it was crazy. So I'm just wondering if some people I know are out here with schizophrenia and it's undiagnosed.
Quite possibly, because you know what else? We don't want to go to therapy. The older generations don't want to do anything to work on themselves.
And it trickles down.
And so I'm certain there's tons of people walking around in these streets, undiagnosed, unmedicated, when they could be medicated and diagnosed. And they need to be, okay?
Yeah, there's like some type of stigma going on where if you feel like you have to go to therapy, there's like a problem. But I think therapy is amazing for everyone. I'm not currently in it, but I would like me and Corey to go to therapy. I mean, she tells me everything, but I want to find out why she only like tells me everything. Why is it that she feels so comfortable with me? Even if somebody else is keeping her, and if her stomach hurts or her head hurts, she'll call me and she'll tell me.
Well, I have some answers to that, but we won't go into it. But you're her primary caregiver. That's why.
I just need her to know that she needs to find at least one other person here on earth that she trusts as much as she trusts me in case something happens to me. Because then she's gonna really need a therapist.
Yeah. You know. So you guys can work on that. Tell her, speak up for herself. Advocate for herself.
Mood stabilizers. So that's for like bipolar disorder. Because their mood can be all over the place. And mood changes associated with mental disorders. So these are all medications that a person may need. And a lot of times people are in therapy and they're also on medication as well. some therapists feel that if they're on both in conjunction, it has like a better effect. But some people are just in therapy. Some people don't need medication. They don't require it. So
Yeah.
and some people get on medication for small little time frames, small windows for different things. Sometimes your past can be traumatic and it can cause anxiety. Like just yeah.
Or sometimes you're going through one of the triggers we mentioned earlier, like a divorce or a death, and you just need that additional support of a medication to help mellow you out and stabilize you so that you don't go over the edge or stress yourself to the point where you do end up with one of these other chronic conditions
or in the hospital.
and then you're sick, right? Like we've heard, I don't think people really think of it like this, but like your mental is so connected to your physical, and I cannot stress that enough, that you think it's just, whatever, like this thing happened to you and maybe you are sad about it or angry, but a few years later maybe you have a heart condition. Like it's all connected.
It is. And I don't think people understand that. But one thing that you guys need to know is it is okay to go to therapy. It is okay to ask for help, whether it's from a friend, from a loved one, from somebody that you trust. It's okay to ask. Like, if you feel like hurting yourself or anything like that, think twice. Yeah. Go and talk to somebody first, because you are loved by somebody. Somebody out here does love you, and they would be devastated if something happened to you.
And it's also okay to get on a medication if you need it, right?
Yeah.
So if you feel like it's just too much day after day and you're just in this cycle of depression where you can't get out of it, you've tried journaling, you've tried therapy, and maybe those help a little bit, but they're not completely taking you out of that dark place, then you may need medication. And that's also something you can talk to your PCP about. It's critical to help you live a more, not only like a healthy life, but
more stable,
happy, like a happy life. Like nobody wants to wake up day after day and be sad
or dread that they even woke up.
Right. Dread going to your job, dread just carrying out your daily activities of living. Like, and sometimes medication is what you need, even if it's, like Kim said, just for like a short period of time. If it's for the rest of your life, if that's what you need because you have some type of like chemical imbalance now, that's what you need. And you just need to take care of yourself and do what's needed for yourself.
Don't be ashamed. Don't be embarrassed. Just do what you have to do for yourself. Take care of you first, because, honey,
just like they say on the airplane, before you put on the oxygen mask for the other people, put yours on first. There's a whole joke behind that, but put your oxygen mask on first, okay? Because if you don't take care of yourself, and you have, let's just say you have kids or anyone that depends on you or anyone that looks to you for support, if you don't take care of yourself first, you cannot take care of them. You cannot be there for them.
And that would suck.
Yeah.
All right. We got anything else for these people out here?
No, I think the only other thing, because I'm thinking about it, is do things that you enjoy. Like if you like listening to music, if you like watching like comedy specials, if you like exercising, if you like dancing, do more things that you enjoy. If you enjoy cooking, do that if you can afford the grocery bill that we talked about. Add more things that you enjoy into your life instead of thinking about, okay, what can I take away or what firm boundary do I need to put up? Add more things that you love. Yeah. Add them.
Just be safe with it, because something that you love might not be legal or it might not be safe.
Yes. As long as it's safe and it's not an addiction of any sort or a substance that is legal or legal. Okay. Nobody's telling you to go out here and be an alcoholic or, I don't want to say.
Just live
But
life to the fullest. is
Live
what you're
life to the
saying.
fullest. Add healthy things that you enjoy into your routine. Have a routine. And I think that really goes a long way.
It does. It definitely
It does. It does. But take care of your mental before it starts impacting your physical. That is really the point of this. Wouldn't you say?
I agree completely.
Yeah.
And we should also try more so to take our own advice.
Yeah, we should. We should.
Mhm.
I feel like I've been doing it lately, and I
No,
can
you
honestly
definitely
tell you
have.
guys, I feel good.
And she looking good too. I said
Oh,
she
thank
looking
you.
good.
I'm feeling really, really good. So
And when Jasmine said possibly see a comedy special, she wasn't talking about us because I know y'all be back there cracking up, but she wasn't talking about us. She was talking about real comedy special.
oh, this is actually a comedy special. Yeah. Okay, so for those of you that are watching this on YouTube, I meant to say this in the beginning, but whatever. Make sure you subscribe to our channel, okay? And make sure you turn your notifications on so that you can get alerts when we post new episodes. All right?
Can they subscribe on podcasts and Spotify too?
Yes. Also, you can subscribe through Apple Podcasts and Spotify. I think those are the only other two that we publish our podcast on. So please do that. Please like the episodes, like the channels.
Tell your friends, tell your mamas, tell your grandmamas,
Right.
tell your cousins.
Tell your cousins, tell your therapist, tell your psychiatrist.
Tell your therapist, tell
Right.
your connect, tell everybody.
Right. Tell the person that's checking you out at the grocery store. Oh, and on top of that, they're making us check ourselves out at the grocery store too.
So it's more money and we got to do it
Right.
ourselves.
And I'm doing the job of the person.
That's why I do pickup, because I'll be damned if I'm going to go inside and scan some groceries.
Right.
Like I'm working at Pathmark.
Right. That was my first job.
I mean, could I let this cucumber slide? And,
What are you talking about?
do I got to scan everything?
Oh. And out.
All right, guys. Well, thank you so much for tuning in. We hope that this episode helps someone out there.
Yes. All right. Bye, guys.
Tune in next time for more